Good morning, sir. Good morning, everybody. Who is awake or is getting woken up?
Okay, so good morning, everyone. Welcome to
our
live
everyone.
session.
Good morning.
We are on 18th of May, 2024. Anybody who wants to join this meeting can join on a Zoom session. We are making it open for the Zoom session number is 818-8591-1572. Today we have a very special and a very beautiful speaker, Dr. B Vijayalashmi. She is joining in on the topic practical cardiology for practitioners. Dr. Vijaylakshmi, she has a very good track records. She's a professor emeritus and former HOD Pediatric Cardiology at Shri Jayadeva Institute of Cardiovascular Science and Research in India. She's a president Indian Academy of Cardiography. Echocardiography, sorry. Pioneer in pediatric cardiology and skilled interventionist. Developed echocardiography criteria for diagnosing carditis and acute
rheumatic fever, carditis in rheumatic fever.
Okay. Awarded as the best presentation at PICS, Chicago, Boston, and World Congress of Echocardiography. She has an excellent academic record with 22 gold medals, 52 publications.
39 gold medals.
Is that the change between yesterday and today?
No, that is the old one you have taken from the net.
Okay,
maybe
so
20 years old. 20 years old.
Okay, okay. I thought this was overnight.
No.
Academic records with you said 39?
Yeah.
Okay, 39 gold medals, 52 publications, 105 research, and 32 international. I'm assuming these are also added.
No, that also old. Yeah.
Okay, these are also old. With 210 scientific lectures. Again, this is, I think, old.
Old, yeah.
So, author of Step by Step to Echo in CHD, and editor in monography of ARF and RHD. Ma'am, over to you. I think I'm assuming...
No. There are two more books which are very popular. One is Comprehensive Approach to Congenital Heart, for which the book review is written by the Mayo Clinic doctor and published in the European Journal. And the other book is Imaging and Catheterization from Pediatrics to Geriatrics. And that was released in India Life in Delhi just last month. So those are the other two textbooks. Most of the postgraduates, they read them.
Very nice. I think very good track record. And I think we are blessed to have you with your immense knowledge, what we will get for our audience. So over to you, ma'am.
Yeah.
Please enlighten us with your knowledge.
Yeah. Can I share my slides?
Yes, please.
Yeah. Good morning and good evening to everyone. And it's my pleasure to be with you all at the HeartCare Foundation, the lecture number 171. Probably that's a very lucky number. And I'm going to speak about the practical cardiology for practitioners. Why this is important is a family physician or a practitioner or anyone who is following other, expert in the other departments, they should know something about the heart. Because in every family, there will be someone or friends. And then if you don't diagnose or if you don't suspect in time and refer to the cardiologist, we may lose the life. And so family doctor is at the base. And then the physicians and the surgeons and the super specialist like me is a mediocre doctor who comes in the way of the patient when the person is about to die. And that should not happen. And hence, we must have a comprehensive view of cardiology to guide the patient and to the appropriate treatment can be given in time. So I'm going to divide my lecture in 6 parts, mostly going to stress on the ischemic heart disease, because nowadays heart attacks have become very common, especially among the youngsters. The next one is the diabetic heart disease, and the diabetic incidence has increased tremendously with the advent of junk foods and wrong lifestyle, and the hypertensive heart disease and the peripheral vascular disease, especially with the diabetics and the smokers. This disease has increased. And then the rheumatic heart disease, though it has come down, it is still there in the Indian subcontinent and the African continents. And the congenital heart disease, of course, because that is closer to my heart. And then I'm going to end with that. Friends, believe me, the chest pain is the cardinal symptom. The single most important symptom for any cardiac disease, that is a coronary artery disease, is the chest pain. And this is the simplest and the best method to diagnose the chest pain is listening to the patient. Listen to the patient, take a meticulous history, and my professor is to tell, taking the history is an art. Of course, nowadays the youngsters have stopped speaking to the patients, and as a result, they go wrong. See, patiently listening to the patients is very important, and giving the comforting words and consoling them reduces half of their anxiety. Then comes the physical examination, electrocardiogram, that is the ECG, echocardiogram, enzymes, these are all the investigations. But what is most important is we have to distinguish between a non-cardiac chest pain and the cardiac chest pain. Why this is important is, once I delivered a lecture on a heart attack in a medical college, and my senior professor, who was a physician, was there. And at the end, he commented, because the whole audience was with me. And then he said, no, don't be impressed by what Vijaylakshmi is telling. If there are 100 patients in the outpatient with the chest pain, and only one will be with the MI, and all the 99% of them are not cardiac. I said, sir, with the due respect to you, I perfectly agree with your comment. Practically, that is the correct one. But if you take what is happening, that one person dies of heart attack, it is 100% loss to the family. And that's how the importance of the cardiac chest pain is very important. So most of the time, 40% of the time, you don't know why the chest pain is. If somebody or the other will keep on getting chest pain now and then musculoskeletal is very high. Whenever they do go to gym or they get lift something, they can do the muscle, they have the muscle strain, and then they have the anxiety is very important, because stress has increased, and the stress can cause angina, like looking like chest pain, but at the same time, ultimately can lead to the coronary artery disease. And then gastrointestinal, especially when there is a hyperacidity, there is a burning sensation, reflux of the acid, and that also can be mistaken for the cardiac. And another 10% is the pulmonary cause, chest pain, and 1% is the cardiac. So we are going to talk about that 1% today, because this is most important. Results demand, why the chest pain occurs? The chest pain occurs because of the demand to supply mismatch. The demand of oxygen by the coronary or the myocardium is more, but the coronaries are not able to supply adequate blood, and that causes the demand to supply mismatch, leading to the chest pain. So what are the coronary causes of the chest pain? One, atherosclerosis, that is the blockade in the coronary arteries. Two, spasm, vasospasm. This invariably happens whenever the catecholamines are released more in the brain, when there is a stress or anger, and all that will lead to the coronary spasm, and then they'll have the problem. The third one is the thrombosis, especially post-corona, the thrombosis incidence has increased, and this can be due to the other causes also. The third one is the dissection in the coronary artery, and the last but the least is the coronary AV fistula. So there is a coronary steal syndrome. There is an anomalous coronary artery arising from the pulmonary artery, what we call as a alcapa, and this is invariably seen in the children. not in the adult. And all lead to the angina. And this angina, you have 4 varieties: stable angina, variant angina, angina decubitus, and angina unstable angina. Most dangerous one is the unstable angina. This is the unstable angina which leads to the myocardial infarction at any time. So one should be able to detect that. So what are the other cardiovascular causes for the angina? One, if there is an aortic stenosis, you might have seen that the children going to school or playing, or even the police take going for the entrance, they suddenly fall dead. And that is because of the aortic stenosis, and when they exert, they have. Another cause for the sudden death is a hypertrophic obstructive cardiomyopathy. Whenever there is a hypertrophic obstructive cardiomyopathy, they can have the sudden cardiac death and the angina and the hypertension. And the severe systemic pulmonary hypertension, when the blood pressure is 200 and 120, and they'll have the chest pain. It is not the heart attack, it is because of the increased blood pressure. And then severe pulmonary artery hypertension, or the RV hypertrophy, right ventricular hypertrophy, or aortic regurgitation. What happens is the blood supply through the coronary to the heart is during the diastolic. When there is aortic regurgitation, the diastolic pressure is very, very low, and hence the coronary flow reduces, and then they'll have the angina. And apart from that, severe anemia. Anyone with the severe anemia, especially in the developing country, the children and women, they can come with the chest pain, and because of the hypoxia. And the non-ischemic origin are the aortic dissection, pericarditis. Especially in the Indian subcontinent, we have the tuberculosis as well as the infective pericarditis, and that can cause the retrosternal pain. And mitral valve prolapse, what we call as the MVP, is another cause for the chest pain. Here, reassurance is important. Now, there was a time when we were students, our teachers used to show the X-ray like this and then teach us about the dissection of aorta. And here, the persistent pain will be there. This will radiate to the lower lumbar region, whereas the cardiac chest pain never goes to the lumbar region or below the umbilicus, whereas this dissection will go below the lumbar region. And then this is how the X-ray they used to show the flap. But today we have the CT, angio, and the angiogram, and we can make a perfect diagnosis of dissection. So what are the differential diagnoses? Thoracic outlet syndrome, they can have pain in the left arm, and then that will be mistaken as the angina radiating to the upper limb. Cervical spondylosis also they can mistake. But remember, these things are constant and they stay for the whole day. And costochondritis, there will be tenderness at the costochondral junction. Herpes zoster, you'll have, of course, the vesicles will be seen. And the pulmonary causes are the pulmonary embolism, pneumothorax, pneumonia, and pleurisy. But remember, the pleuritic pain is more on sneezing and coughing, and that is different from the angina. So a practitioner should be able to distinguish between these causes. And this diagram shows the causes of the cardiac pain and also the esophageal pain. Esophageal pain is mostly in the epigastric region and the retrosternal region. It never radiates to the arms. Whereas the cardiac pain, it is retrosternal, it radiates to the neck and to the arm. So the anxiety, they will show with the finger, this is the pain. If they pinpoint and show, that means it is the psychogenic. And the depression, cardiac psychosis, and all of them can, and to get the self attention, people may talk about the chest pain. But never neglect any complaint of the chest pain until it is ruled out. Now, if you look at the diagram, this is the location. Most of it is the retrosternal. Though the heart is on the left side, originally it is the central organ, and as a result, you have a pain here, and the referred pain is to the neck and to the lower jaw. It never goes to the upper jaw. That is a dictum. And then you can have pain in the left shoulder, left arm, in the ulnar region, epigastric region, and also in the interscapular region at the back. So this is the pain. If anybody comes to you and tells that this is how the pain is going, when they exert or when they have the anxiety, when they have the problem, and then that has to be taken very seriously. Maybe it will associated with the sweating, palpitation, fatigue, giddiness, and sometimes they feel anginal pain is so severe that they feel that impending danger of death. And this is how one has to distinguish. And as soon as they sit and take rest, the pain disappears. So, what are the angina equivalents? Described as the tightness, pressure, burning, heaviness, aching, strangling, choking, or compression. Because a person may not tell that, oh, doctor, I have the angina. What they come and tell you is there is a tightness in the chest. They have the choking sensation. They feel there is something is aching. There is a heaviness in the chest. So these are the expressions that the patient gives. So a practitioner should know that the moment they're telling something which lasts for just 2 to 3 minutes and disappears, or taking rest, that is the angina. Because anything that is more than 15 minutes is unlikely to be anginal pain, and then hence relieving after rest is a very important thing. Sometimes in the diabetic patients, the pain sensation is very less, so they may not tell that it is the chest pain. So these are called as angina equivalents. So these complaints almost indicate that it is angina, and that is because of the when diabetes, and they have the reduced pain sensation. So they may complain about the breathlessness on exertion, easy fatigue that indicates a global ischemia because they have the left main disease, the belching, nausea, indigestion, dizziness, sweating, choking sensation. And you might have seen the American pictures, the pilot is flying the plane, and suddenly he gets a choking sensation and he starts burping, and then the plane crashes. So all that is angina equivalent. The sites of secondary radiation are ulnar aspect of the heart, fora, lower jaw, teeth, neck, and both the shoulders, or in the interscapular region. So there is and you have to remember PQRST is the one. So what are the PQRST in the angina? P is always angina is provoked either by exertion or the stress or playing or mental strain or the anger. What activity brought about the preceding episode of chest pain? The history has to be taken. Q indicate the quality of pain. Invariably, it is crushing or stabbing or burning, heaviness, and a clinical clinician should take the history. Then R reads region or radiation, and that I have already explained. S means the severity, how severe it is. Rate of pain 1 to 10 on the scale, and being the least painful and the 10 being the most painful. T stands for timing. Describe the duration. If it lasts for 2 to 5 minutes, relieved after taking rest, that is the angina pectoris. So there was a time when Eindhoven used to dip his leg and then do a huge machine to take the ECG. But now the ECG can be taken and they can be sent on your mobile with the telemedicine. So a normal ECG does not rule out the coronary artery disease. Many people are in the habit of coming and telling Dr. ECG, take the ECG. The ECG is not a diagnostic to rule out the coronary artery blockage. And LV function on the echo also does not rule out. So ECG taken in the absence of pain with the patients and no history of MI, invariably they are normal. But obtaining ECG while experiencing the chest pain is more rewarding, and that will be better. So new horizontal or downsloping ST segment depression indicative of the ischemia. So you must always look at the STT changes, and the STT changes depression indicate there is a ischemia. And here the treadmill test is very important. Many of them are used to doing the treadmill, and we have seen that many people while doing treadmill itself, they have collapsed and died. So those who have the aortic stenosis and they are not aware, hypertrophic cardiomyopathy, when they do the treadmill, they fall unconscious because of the hypertension. So here one should remember that If the person has attained 4 meds and it is negative, that means he getting the heart attack in the next 4 years is almost 99%. It is not there. The false positive, false negative also can be there, and this is to be left to the cardiologist. So remember, if anyone comes to you with the treadmill report, and if they have reached 10 to 11 meds, they're active, normal, very nice. So active people, they can reach even 16. My pharmacology professor came to me at the age of 70, and he used to come to the hospital with on the bicycle. And then he reached 25 meds. I have never seen anyone with that. So those who are active in their life, always cycling and doing the exercise, and they can reach any even up to 16 or 25. But normally, if anyone reaches 10 meds, that is good enough. And here, remember, anyone who reaches only 2 to 3 meds, that is very serious, and almost 1 med and they get giddy and hypertension, that means it is very severe, and then they have to go for the emergency coronary angiogram. So we must remember A, B, C, D, E. What are A? A stands for aspirin. Anyone with chest pain, put them on aspirin. B stands for beta blocker and control the blood pressure. C stands for cholesterol. Get the lipid profile, treat it, and then ask the patient if they are smoker to stop smoking. D stands for diabetes and the diet and lifestyle has to be changed. No junk food and more of the leafy vegetables and the fruits, very important, and control the diabetes. And education and exercise are also equally important. So this is how it is important. In the past, we were giving only AC inhibitors, beta blockers, and then the AC inhibitors and the statins, which showed the reduction in anywhere between 20 to 42%. But today we have newer drugs. So aspirin is universally accepted, and then it is anywhere between 75 to 150 milligrams can be given to anyone who has got the coronary artery disease. And now we have the clopidogrel used for the patient, and we have the other drugs also when the aspirin causes the gastritis. Then we have the beta blockers, and the beta blockers is the first line of agent for any hypertension patient, and invariably they are contraindicated. So AC inhibitors are also very important, and cholesterol lowering medications. All the patients with the atherosclerosis block or the anginal patient, once it is determined that they have the coronary artery disease, regardless of the level of LDL, they should be started on the statin. And LDL level should be maintained below 100. And then start upon the admission, the continue indefinitely. Then comes the nitrates. Anyone with the chest pain, they should carry nitrates in their pocket. So the moment angina comes, the sublingual, under the tongue, the nitrates must be kept. And the calcium antagonists are also very important. Among the anginas, I told you, the unstable angina is the most difficult one. Unstable is, there is a plaque, atheromatous plaque, it ruptures. Once it ruptures, then there is the thrombosis, and suddenly the person comes with the. So here, the plaque disruption, acute thrombosis, and vasoconstriction on top of that, all will be added. And here nowadays, even if the coronaries are normal, we are giving importance to the calcium score. So the patient may come and ask you, and then you can get the CT angio and see that look at the calcium score. Anywhere between 11 to 100, it's a minimal coronary artery disease. Anywhere between 101 to 400 is a moderate. Beyond 4 is a severe one. One has to be very careful. Why are we so much bothered about the heart attack? It is because it's a prime killer in the prime of the life. And nowadays, you can see that even the youngsters, they are falling dead with the sudden heart attack. And so it strikes like a bolt in the blue. And many of the people, they do not understand the difference between the cardiac arrest and the heart attack. Practitioners should know that cardiac arrest is when there is arrhythmia, ventricular tachycardia, ventricular fibrillation, degenerating into agonal rhythm and death, and that is the cardiac arrest. That means the heart stops beating. And heart attack is the coronary artery is the first branch from the aorta. Whenever there is a block in that, and then the thrombosis occurs, you can see that the plaque rupture has occurred here, and because of the plaque rupture, the thrombosis. Whenever there is a leaking, the platelets go and get aggregated there to block the leakage. And with the platelets, the thrombosis occurs. And that's how we know the heart attack occurs. And 25% of the heart attacks nowadays are due to the tobacco and also the drugs like the cocaine. And that is very dangerous. Now, any person with the severe pain, excruciating pain with the heart attack is like a building on the fire. So as early as the firefighter comes, the damage is controlled. In the same way, if the person comes to the hospital within 1 hour, that is called as the golden hour. So clinical physicians should remember, once they have the severe chest pain and the ECG shows the STT elevations and the heart attack is suspected, shift the person immediately to the cardiac center where they can give either the thrombolytic therapy or can do the primary angioplasty. So whichever the patient wishes. So here 15 lakhs thrombolytic therapy is given. And what is angioplasty? Wherever the block is there, cross it with the guide wire, put the balloon and open it up and put a stent. And that is the primary angioplasty. And what is the bypass surgery or the CABG? They take the veins or the arteries from the arm or in the chest, that is the left internal memory, right internal memory artery, and they collect from the aorta to the distal to the block. So this is called as a bypassing the block, and that's how it's called as the coronary artery bypass surgery. So here, lifelong aspirin, lifestyle modification has to be done, risk modification, risk stratification, all has to be done, and the clinical physician should be aware of that. And this is how the stents are, and the stents are inert material, which is like a scaffolding. Whenever the controlled rupture is done and the injury is there, that vessel is likely to collapse. To prevent that, the stent is put. And this expandable stents, balloon expandable or self-expandable, they keep it there. So here you can see that this is a 40 years old man, diabetic and the smoker. The whole of the coronary artery is blocked, and I have put almost a 54 millimeter stent, and this is how the coronary artery is reconstructed. This is another patient of mine, 45 years old person with the complete 100% block of the right coronary artery. With the balloon, when it is opened, you can see that it is opened well, but there is still a residual lesion. So when there is a residual lesion, in that we put a stent, and once the stent is deployed, you can see that the coronary becomes totally normal. So this is like a repairing the road. Bypass is a building another road, bypass road. So that is the difference. So this is without surgery and very important. Now, most important preventable cause of coronary artery disease is the smoking. Unfortunately, today, women also have started smoking, and that is very bad. So God had given them the hormonal protection until the menopause so that they don't die of heart attack and the children don't become orphans. But unfortunately, that they are neutralizing by the bad thing, like almost like competing with the men in smoking and drinking, and that is really bad. Smoking is associated with both aspects of atherosclerosis. One, it promotes development of the lesion, thus creating sites of unsuspected blockage, and it also promotes occurrence of the triggering of the blockage. So as a result, this is very important. The next important is the lipid profile or the cholesterol level. So the good cholesterol is the HDL cholesterol, which should be above 50-60 gram. If it is less than 30, 35, 40, that means they are prone for the heart attack. If they are active, not smoking, their HDL cholesterol will be high. And the bad cholesterol is the one which gets deposited like this in the coronary artery. And the LDL cholesterol should be less than 100. If it is anywhere between 130 to 190, it is bad. triglyceride should be below 150. And if it is more than 200 or 400, it is very high. And they have to be on both the diet as well as the drugs. And this is how the normal coronary arteries, and they get coronary, the atherosclerosis plaque because of the bad cholesterol. And nowadays, this bad cholesterol comes from the animal lard as well as the eggs, and also the trans fat, that is from the bakery items and the junk food. So one should remember to keep away from the coronary artery disease, laughing and smiling, and patient meditation is very important. Laughter is the best tranquilizer, which has no side effects, whereas you take 72 muscles to frown, only 14 muscles to smile. So keep smiling and keep away from the chest pain. Unfortunately, people have started frowning and they get stressed. The stress is the three types are there. One is the eustress. You have a target, like I have to speak at 9:30, I prepare, and that is the eustress. The stress is you are not done the good work, and then you start worrying what will happen. Oh, whether the target can be reached or not. Distress is not in your hand. It is an unimaginable problem is there. Just leave it to God, and that is the way to handle it. So never be the type A personality. And now it is known that type A personalities who are aggressive, who want the achievers, who want to do everything at the cost of the others, they get a heart attack. So don't become the stress junkies. Advise your patients to have the adequate sleep. Now it has been shown that anyone who sleeps less than 3 hours every day and whole night they do the video game playing or partying, they have the tendency to get heart attack more. And another thing is anyone who is having what to say, that afternoon slight nap or the dosing, their heart attack comes down by 65%. So don't become the stress junkies. Advise them the shavasana. Why stress is important is a person when he's stressed, his genes get changed. The telomere length comes down and they get the premature senility. So protein synthesis comes down, the poor digestion occurs, increased blood clotting occurs, increased blood pressure occurs, and increase in the HCl in the stomach. The hydrochloric acid becomes more with the stress, and then they are always hyperacidic. So when they are having a hyperacidity, they can't make out whether it is the hyperacidity or the chest pain, and they become almost neurotic. So body releases more sugar during the stress, and then faster breathing occurs, the higher cholesterol fatty acids in the blood are seen. And hence, the stress has got a very, very bad effect. Just in opposite to that is meditation, yoga, that reduces your stress, and then mind becomes very calm. So when you meditate, the endorphins and neuropeptides, which are called as the feel-good hormones, are released, and that is 100 times more powerful than the morphine injection that we give. And this was proved by the Japanese. The Japanese people who are very, very hardworking, living for 100 years, suddenly the youngsters at the age of 30, 35, they started coming to the hospital, and then they realized that what is called as they called this as the Takotsubo syndrome. That means the octopus caught in the trap it just bloats, and the left ventricle was looking almost like this death trap, and that's why they called it as the Takotsubo syndrome. And they didn't know, they did all the investigations, everything. What common thing they found was they all were frustrated, aggressive, angry, and depressed, and then anxiety was there. And they realized this, there is no allopathic drug for that. And what they did was they followed the Mahesh Yogi's transcendental meditation for just 20 minutes. So the pumping capacity, ejection fraction, which was just 10-20%, within 3 days, that is 72 hours after the meditation, that became almost 50-60%. So then they realized that this is the stress-induced cardiomyopathy. The coronaries are normal, and so the meditation and yoga are very important. So along with the other activities like swimming and cycling, most important is the Surya Namaskara and Chandra Namaskara, which have got the 12 asanas, and top head to toe, you get the total relaxation and say no to the junk food, and then go for the good protein and the reduce salt diet. So for this, remember, obesity should be controlled. Weight as obesity is the mother of not 5 deadly diseases: high blood pressure, high cholesterol, heart attack, and now even Alzheimer's is caused by the obesity. And limit your salt, alcohol consumption should be stopped. Eat food rich in potassium like bananas, oranges, melons, or sweet melons. So a practitioner should be able to guide his patients what are the things to be done and what should not be done. And the do's and don'ts must be taught to them. So no smoking, and take a time to relax and meditate, and your activity regularly 30 minutes of walk at least 5 days in a week is a must. And whatever drugs is prescribed should be taken. Maintain your blood pressure at normal. My blood pressure is 100/70 at the age of 74, and my daughter's is 130 by 90. When I tell her not to get anxiety, she says, Amma, you are abnormal. So younger generation are going for the abnormal lifestyle, and lead a good and healthy lifestyle. Say no to the junk food. The junk food leads to obesity, diabetes, high blood pressure, heart attack, and high cholesterol. So coming to the diabetic heart disease, diabetes is a strong risk factor for the ischemic heart disease, both in men and women. Mortality with the coronary artery disease in diabetic women is almost 7-fold higher than the non-diabetic. Diabetes is 5 to 7 times more in the urban women, because post-corona, we have seen in Bangalore itself, obesity has increased by 30% in the women and children. The silent myocardial infarction is much higher among the diabetics. Hence, reaching the hospital is delayed because they are not aware that they have had a heart attack. So diabetic cardiomyopathy is another problem, and adverse prognosis is there. And that's why many women also, when they come with the MI, the coronaries are so badly damaged because they are not having adequate exercise. So diabetes mellitus, the metabolic and the infective causes of mortality amongst the diabetics, has certainly come down with the invent of the insulin and the stricter control. But still, many patients on the oral diabetics which are not controlled well, they are prone for the coronary artery disease. So cardiovascular complications have gone up mainly because of the higher morbidity and mortality according to the Framingham study. So how does the diabetes affect? 1, atherosclerotic coronary artery disease. 2, diabetic cardiomyopathy. 3, autonomic nervous system dysfunction occurs. And as a result, the pulse will be problematic. And as a result, this patient, they come to the doctors. So any diabetic patient you have, keep a watch on the microalbuminuria and get the investigations done in time, like the treadmill exercise. So psychological is a higher threshold and tolerance for more painful thing. So diabetic patients, they don't feel the chest pain because they have the higher threshold for the tolerance for the pain. Then endogenous opioids are also high, and lower cortical activation, diabetes autonomous neuropathy. Because of this, they don't feel the pain sensation. Diabetes is an independent risk factor for almost 55% in diabetics, and then compared to non-diabetic. And left main disease, that is the one which causes the sudden death or the global ischemia, is 13 times more among the diabetics. So every doctor, whoever, if in their family or among the patient, if they are diabetics, keep a watch on the coronary artery disease. And this is very important. So here both the epicardial and the intramural vessels are affected. So 25% silent myocardial infarction is more common in the diabetics. 32 to 40% of them have the atypical symptoms like confusion, saying like I told, the angina equivalent. then higher mortality compared to the non-diabetic, almost 28% higher, and the higher mortality in women who are diabetics. So higher incidence of complications are also seen among the diabetics, and hence we have to be very careful of all the diabetic patients. Nowadays, more diabetics are living for a longer time. Diabetic neuropathy is also there. And as a result, the hypertension, albuminuria or microalbuminuria has to be kept in mind, and they have to be put on the ACE inhibitor. So hypertension with diabetes, they reduce the hypertensive drugs, they reduce the hyperglycemic reaction to stress, and hence diabetics on beta blockers may not experience the typical features of the hypoglycemia, and they come very late. So you must be very careful what drugs you are putting in the diabetics, and avoid beta blockers and diuretics among the diabetics. Diuretics worsen the glucose tolerance and insulin sensitivity, and also make the control of the volume expansion. So diabetes, diastolic pressure must be maintained below 75, and that is the very important. For every episode of symptomatic ischemia, a patient should detect them. Holter monitoring must be done if they have the symptoms of palpitation, and within 24 hours, if the Holter monitor shows the total ischemic burden is more than 60 minutes, that means they are going to get the cardiac events. So such patients with the Holter monitor, if the total ischemic burden is more than 60, they have to be sent to the angiogram. The sudden cardiac death is very common. Mortality after 6 months is almost 60%. Mortality after 5% is 79%. And that's how now we have started doing the strongly recommend the angioplasty or the bypass surgery for the person with the angina. So screening is very important in this patient. And now we move on to the congestive heart failure. So congestive heart failure is the one where the left ventricle starts reducing in the ejection fraction, and it cannot pump the adequate blood. So in the failure, in the past, we were giving enalapril or the ACE inhibitor to reduce, because the ACE inhibitors, the HOPE study showed that the stroke, the cardiovascular events, and the non-fatal myocardial infarction all reduced with the ACE inhibitors. But today we have the fantastic 4 drugs. More than the ACE inhibitors, these fantastic 4 drugs, all the practitioners should remember. John McMurray and Milton Packer, they challenged the heart failure drug treatment with the fantastic 4 published in the European Heart Journal in 2020. As coined by the duo, they called it as the fantastic 4. The drugs used for treating the heart failure with the reduced ejection fraction or with the normal ejection fraction: 1 beta blockers, 2 angiotensin receptor neprilysin inhibitor called as the ARNI. The ARNI has become a game changer now. And then the sodium glucose transport 2 inhibitors, which is called as the SGLT2 inhibitor, and 4 mineralocorticoreceptor antagonists, that is called as the MRA. So these 4 drugs are the ones, very, very important. Instead of ACE inhibitors, now they are used. And what is important is heart failure patient, either they used to die or very few of them, they used to go for the transplant. Literally, this fantastic 4 drugs can prevent the patient going for the transplant. And that's how we know in the past, any heart failure patient, we say, oh, that's the end of the life. But no, today there is a bend in the road. And when you bend and put these patients on this fantastic 4, you can literally prevent they going for the cardiac transplant. This is the place where the salt was being prepared by the emperor 3000 years ago in China. And then he found that anyone eating more salt, their blood vessels used to become thick with the pulse. And then there was a time when they used to let out the blood, and they used to say, bravo, Bill, bravo. But today, no more. Today, whatever the cause of the hypertension, whether it's essential or renovascular, where renal artery stenosis, we can open that. See, here you can see that the left renal artery is blocked, and I have opened it, and now aortoarteritis, if the patient has got a non-functioning kidney and because of that hypertension, and this child was on 3 drugs, and then they had advice for the surgical nephrectomy, but then the child was not fit for surgery. So BP was 240 by 120 with 3 drugs. And what I did was I just put the coil in the renal artery. So it is a non-surgical nephrectomy was done by just a simple coil, and the BP came down and the child is doing very well. So coarctation is another condition where they can have the hypertension in the upper limb and no blood pressure. So here I tell be Indian and touch the feet, and you'll never miss the diagnosis, because bounding pulse in the upper limb and no pulse in the lower limb indicates coarctation. So this patient had a rheumatic mitral stenosis. All the time patient was put on penicillin prophylaxis and their drugs. But when I came with the pulmonary edema, atrial fibrillation, and that time when I felt the femoral pulse, there were no pulse, and I told my professor, this is the coarctation. So in the same sitting, I did the coarctation dilatation as well as the mitral stenosis opening. And these are the, rib notching was seen in the past. But today, even the newborn babies, we are opening with the balloon. And as a result, the rib notching is not there. This is the 40-day-old baby, came with the heart failure, and the BP in the upper limb was 220 by 110 because the medical college professors had put the patient on the inotrope thinking that the patient is in the heart failure. And now ejection fraction, which was 35%, it became 55, and the BP came down to 110 by 80. And you can see that it is almost like the dead end, and I opened with the balloon and the patient made a good recovery. And today, even the grown-up children or the adults can be taken for the non-surgical management, because surgery is very risky. The mortality is very high because of the cholesterol. And in Asian countries, this aortoarteritis or the non-specific aortoarteritis is very common. And this is just a 9-year-old child with the mid-thoracic syndrome. And this was opened with the balloon and the stent was put. Now he has become a young man. So aneurysm can be treated with the covered stents also. And even the coronary, apart from the coronary, the carotid artery block can be made out. So hypertension can cause the cerebral rupture and then the hemiplegia, and also carotid artery thrombosis also can lead to the hemiplegia. So this also can be opened up and stented. And past, they used to come with the gangrene, whether the diabetic, smoker, and all this is a gone case, because today we are able to do the peripheral angioplasty and do the stenting. And this is the patient where I have put 2 stents simultaneously in both the common iliac artery. He could walk only about 20-30 steps and he made a complete recovery. So this is how the treatment is there. Moving on to the rheumatic fever, which is my field, that we used to tell that rheumatic fever licks the joint and bites the heart. But today, we don't have to go for that. I have given the criteria for the diagnosis, and none of our patients go for the heart failure like this, because they are diagnosed in time and treated. So here you can see that there is a severe mitral stenosis, and as a result, the left ventricle is so small, right ventricle and right atria are big, and then this patient underwent the balloon valvuloplasty. But today we have the transvasive esophageal echocardiography, and we can see that when there is a mitral stenosis, invariably they'll have the thrombosis in the left atrial appendage, and that left atrial appendage thrombosis can be seen on the transesophageal echocardiography very well. So the precise and early diagnosis of acute rheumatic fever, if you put the patient on penicillin prophylaxis, nearly 35 to 40% of them, they revert back to the normal. And hence it is very important to make the diagnosis. In the past, a pregnant woman with the mitral stenosis used to die during the delivery with the pulmonary edema. No more. So emergency balloon dilatation is done, and she delivered the same evening, and next day she's sweating, but she's alive. So now we can cover the abdomen, and hence any patient with the mid-diastolic murmur, Even the juvenile mitral stenosis, please see that they are sent in time to the cardiologist and they can be treated. So I had presented this juvenile mitral stenosis, calling it as the malignant mitral stenosis in the TCT, Washington, DC. And then, people appreciated a lot. So here you can see that when you compare with the adult mitral stenosis, the juvenile mitral stenosis, they do very badly. But still, today we have the balloon dilatation. So moving still further, coming to the fetal echo, now folic acid, B12, niacin can prevent the congenital heart disease. With the heat stroke, the heat wave going on everywhere, it has been just the other day, I had the discussion on the heat wave and the sunstroke. And whenever the body temperature of a pregnant woman increases, and then the spina bifida as well as the congenital heart diseases are more, because the heat acts as the teratogenic. It has a teratogenic effect. And now we have the fetal echocardiography can make the diagnosis in time. If there is an AV canal defect like this on the echo, we can get the karyotyping blood and we can see where the genes is and tell the parents, if you get the child, it will be Down syndrome like this. Would you like to have or not? Even if the heart is operated, the brain will not be normal. The child will be having the Mongolian features, and then the child will never grow up. So all the congenital heart diseases, now we are able to make out the left-right shunts like the AST, last time I had spoken. Next, I'll speak on the ventricular septal defect and the patent ductus arteriosus, coronary fistula. All these things can be treated with the devices made by Dr. Kurt Amplatz. And from 1998 onwards, we are using these drugs. And here you can see that this is the patent ductus arteriosus shown here, and that is the device. So 100% pure, and this is how the PDA is closed with the device, and the patient can make a perfect recovery. This is the large ventricular septal defect with the hypertension, and they make a good. So this is the dextrocardia with the VST, and I have closed it very easily within minutes with the ADO2. Even the child born, newborn baby with the pulmonary stenosis with the pinpoint pulmonary artery, no flow at all in the lung fields can be opened, and this is though riskiest, we can life-saving balloon dilatation can be done. Hydros fetalis, pinpoint aortic stenosis, and this was on the ventilator, and I opened it with the 4 millimeter PTCA balloon, and now the child is so mischievous and doing very well. So this lady, pregnant lady, came with a severe aortic stenosis, 178 gradient, and achondroplasia, and they were not able to do the normal delivery. To do the cesarean, the anesthetists were not ready. I did the balloon dilatation in the morning, and next day they did the cesarean section. So this is how the interventions are there, and the general practitioner should know that today the technology has advanced so much. With the just small 2 millimeter or 1 millimeter punctured nick on in the groin, everything can be corrected in the heart. And that's how, almost it has become like a magic. So important thing is we should know that once they go for Eisenmenger syndrome, nothing can be done. So in the past, people were blaming, the parents used to blame the doctors used to blame the parents not coming in time. But today we have to work together, the parents, the people, and the pediatricians and the clinicians, all of us, we should start working together. We must learn from each other. And that's how the today's 171st lecture, I'm sure it will be an eye-opener to keep our mind open. And as a family physician, you must tell the patients that they are the captain of their ship, and they have to see the tip of the iceberg and keep the ship safe. And practitioners can prevent the disaster. This is the Chinese saying, the superior doctors prevent the disease. Mediocre doctors treat the disease before it is evident. And inferior doctors like me treat when it is a full-blown disease. So today's lecture is for preventing the disease so that you detect in time and send them in time to the cardiologist so that they are treated adequately. So friends, to conclude, the best physician is the one who is able to distinguish between the possible and the impossible. And I'm sure all over the world, all the physicians who are the best people to save their lives and to give a better quality of life to the patients are capable of distinguishing between the possible and the impossible. Anything is possible. The sky is the limit. And thank you very much for your kind and the patient hearing.
I would like to invite Dr. Monica Vasudev to give her comments. Dr. Monica, you're muted.
Thank you, Dr. Vijaylakshmi. Thank you, Saurabh. A fantastic presentation. And all I want to say is that you covered an incredible amount of information that I think if everybody goes back and parses through every single aspect, they would have completed the entire cardiology unit of their education, both practical and basic. Your topic titled Practical Cardiology for Practitioners, I think was summarized in one slide that you had given. And it's when you talk about A, B, C, D, and E. And in your A, B, C, D, and E, talking about aspirin, talking about beta blockers and blood pressure, anti-anginals as well, cholesterol and cigarettes, diet and diabetes, education and exercise. I'm trying to figure out how to put the M for mindfulness into this mnemonic for you. I was thinking of different words for the letter F to put that in there, but I will leave that task up to you because you are phenomenal in everything that you do. And I love the fact that you talked about bringing mindfulness back into things. And I think being practical and pragmatic is also important, both on the perspective of the practitioner and how we approach, but also for our patients, that they should be practical with life and not go into the extremes of trying new fads and new things, because I think it all comes back to what did you have in your home growing up? What was the good food? What was the wholesome food? What was the wholesome activities, waking up in time, and lifestyles that I think is what we need to go back to. So thank you very much.
Great, Monica. In fact, practical and pragmatic, very, very important. Very nice. And they should be patient also with the patients, not to lose their temper. Thank you.
So do we have any questions on the floor?
Yes, Dr. Saurabh, can I?
Yes, Dr.
Please.
Bukhari.
Yeah, please, sir.
Thank you very much, madam. Very nice presentation, an excellent presentation because you are a subject specialist. But one thing, if you allow me, I want to add in this thing. Along with all these factors, what I have noted in Pakistan and my patients in my hair, mental depression, and this is the very, very important.
Stress.
Along with all these, if even we control our lipid, if even we control our all other things, if we cannot control our mental depression and other things, which are the main cause of cardiac death, even after corona is causing this one in the long corona patients. And so we must, as a senior teacher, I always say to my students that along these all other factors, you should try to calm the patients and ask the patient to control all these mental depressions. No doubt the mental depressions are everywhere, but the things that you have told, exercise, yoga, and meeting with senior friends or other things can reduce these mental depressions. And I think this can reduce the mortality. Mental depression aggravates all other factors that you have mentioned in your. Thank you so much.
So your comment is well taken. And that's why I go to the colleges and the schools to motivate the children. And I stress on 5 S. One is the smoking. That is the first S. Next is the spirit. That is the alcohol. The next is the stress. And the stress is the one which is most important because Scientifically, it has been shown that whenever the person is stressed, the mitochondria as well as the genetic genomes, they change. The telomere length becomes less and they get a premature senility. And along with the premature senility, the premature heart attacks are more common. And next with the sedentary habit and either oversleeping or lack of sleep, both are very bad. And then last but not the least is the spirituality. And that spirituality, jo hona hai ho jayega, don't leave it. And that is not there. And today, when we take everything on our head, we get bogged down under that. And that's how, we must be practical and face the life as it comes rather than taking it to our head and then making our head as the junk.
One thing more, I can ask in a question, but also this is my suggestion.
You can, sir.
I have noted, I am 68 years, Alhamdulillah, and my blood pressure and everything is almost okay. I got 2 times retired from the government of Pakistan, 1 time from the federal government and a first time from the Punjab government. But this is whole that I controlling my thing, everything is due to my diet and my lifestyle.
Absolutely.
But ask what question, in a question, do you agree with me that if the people take dinner late, they are the more prone to get the heart attack?
In fact, I will tell the other way around. Those who take the dinner earlier, they have a healthy life. That is because they will have the other end. I'm going, you are asking the.
My suggestion was that if we remove remove the dinner from our life, and if we take the breakfast and our next lunch or something in 12 hour or 14 hour.
No, sir, you don't have to remove the dinner. Take the dinner earlier. So that you have a 12 hours gap between the dinner and the morning.
Thank you
and
so much.
then, before going to sleep, if you take a glass of milk and a banana, you'll neither have the acidity nor have the hypoglycemia nor the sleeplessness. In fact, you'll have the very good sleep because both banana and milk, they are the best antacids. And then the banana is an antidepressant and that gives a very good sleep. And it is a laxative. It doesn't cause the constipation. Yeah. Virak, please. Virak can ask the question. Dr. Gokhale, your question, please.
Sorry. Hello.
Yeah. Tell me.
Hello.
Yeah, we can hear you well.
Yeah, I just wanted to thank you for the talk. We really very improving, and we liked it very much. Thank you.
Thank you, sir. Thank you.
So anyone else has a question? Dr. Angelique, do you want to say something? Dr. Arta Hussain?
Yeah,
Sorry.
Good morning, everyone. Hi, Professor Vijay. It's a very, very, very great lecture. I learned today a lot. And I think you've proven that your 39 gold medal you received. Now I think CMAAO must also give a gold medal today. I think you deserve it. That will be 40th. My concern is nowadays I hear a lot of people stopping taking aspirin. They say my doctor or some journal or UK is saying there's no need to take aspirin, and somebody is taking once a week, somebody is taking alternate day.
No.
Well, what is your advice? Really, it's confusing nowadays. Thank you.
Yeah, once a week or alternate day, aspirin is no good at all. Only who have already had the coronary artery disease, they have undergone the angioplasty or bypass surgery or the stable angina, they have to take the aspirin. Or if the aspirin is not tolerated, then they can go for the clopidogrel. But then taking aspirin on their own is not good. But in the post-corona period, where the endothelium, which is the largest organ in the body, that is all the blood vessels which have the inner layer, they are damaged because of the corona. So thrombosis is more, and that's how we know those who had a very bad corona infection have recovered and they are put on the aspirin. Otherwise, the normal person like you and me need not take the aspirin.
Thank you so much. Thank
She left, if I'm not wrong, and was on her desk at this hour. So I'm assuming she was on a meeting. Do you have any other questions? Anyone else on the floor? Ma'am, one question I think coming from the youngsters, and especially there's a lot of confusion and fear, especially when the reels, there are a lot of people making reels and, people watch not to what to eat, what not to eat. People who are doing exercise, they have a fear. People who want to get into an exercise program, they are having a fear. People who are not doing anything, they have a fear. A lot of heart attacks are happening, and it's a sudden heart attack, or even a mild chest pain. People stop playing or people stop doing exercise. They say that, okay, there's something wrong. Is there any checks and balances for such people? And uh, what is a primary test people should do rather than rule out and not just to avoid? Because I know, so in fact, I want to mention while we are talking, it's been 3 years. We lost Dr. KK Agarwal on yesterday's date. It was 17th. So we are remembering him with this forum. And I think what is the best way to have a cardiology session on this and have a
sad,
speaker
very
from
sad. He was a good friend of mine and a very active, and he was so innovative and so good in whatever he did. Very unfortunate that corona, it took away such a brilliant cardiologist from us. And that's a very good question. So it is said, Buddha says, whatever is extreme is poisonous. Even Amrita becomes poisonous if it is too much. And that's how we know too much of exercise, going to the gym and exercising and taking the formula. The 19, 20, 22 years old youngsters in Punjab, they are coming with the heart attack. And because the formula contains the steroids, and that is not good for health. That is one thing. And the other side, not doing anything and being lazy is also, the sedentary habit also is not good, because they put on weight. And if they become the couch babies and sitting all the time, now scientifically it has been proved that anyone sitting for more than 6 hours continuously, they have more heart attack. And that's how the IT industry people, in between, they are asked to do the exercise wherever they're sitting, or get up and go and come, because what is called as the non-exercise thermogenesis, and that is called as the need. So even without exercising, moving your hands and moving around, walking around and doing your household work and doing your own work yourself and doing gardening, that also is taken as a part of your exercise. So good activity is very important. So remember, 30 minutes of regular walk, or whatever the exercise that you would like to do, like a Surya Namaskara, Chandra Namaskara, all those things are extremely good to keep your muscles supple and have your stamina good. And regarding the eating, our body, genetically, we are the herbivorous animals, you can say, because the carnivorous animals, they have the canines and the short gut, whereas the herbivorous animals, they have just what to say, like molars for chewing, and then the long gut. So we have 22 feet gut, and that's how we know basically we are born vegetarians. So remember, the elephant also is a vegetarian. So people have a wrong notion that those who eat non-vegetarian, they become strong. In fact, Virat Kohli, who is so popular all over the globe, has become a vegetarian. And now the West also is becoming vegetarian. They're becoming vegans. They learned a lesson from their war with the Vietnam. In the Vietnam, when they lost the war, they learned the biggest lesson when they did the autopsy of their own soldiers who were just 20, 22 years. They had all the blood vessels studded with the cholesterol, because they were eating 3 to 4 eggs and then eating beef, mutton all the day to get the good protein. But along with that, they were getting the animal lard and the bad cholesterol. Whereas the Vietnam people, you can see if you go to Vietnam, the women have such a narrow waist, and none of the obesity is not there at all. That is because of the vegetarianism. So today it is seen those who take vegetables, 2 to 3 vegetables, the fiber content will be more, 28% heart attack comes down. If they take fruits, especially the citrus fruits, they have all the benefits. Along that, they have the antioxidants, which have got the healing effect on the endothelium. So they take away the oxygen-free radicals and prevent the injury to the endothelium. So almost 32% heart attack comes down if you take the fresh fruits. And that's how we know eating in moderation, exercise in moderation, living in moderation, sleeping in moderation, all moderation is very good.
Like, especially when you are in this forum, they ask you to take an artificial form of proteins.
Not good. That's
not
not good. Not good.
So a lot of people end up even non-artificial way because they say there's a very less number of protein in your body, and they eat like 10 eggs or something like that, form of. But what I also came to know is-
Saurabh, I would like to intervene here. Our body requires 100 milligrams of cholesterol, and that 100 milligram cholesterol is generated by our own liver. If you take egg, one egg contains 250 milligrams of cholesterol. So nobody is going to throw the yellow part and eat only the white part because they have paid the money. So it's a yellow part which contains the cholesterol. So if you go on taking 4 to 8 eggs, so 250 milligrams into 8 times, you can see you are stuffing your body with the more than 1000 milligrams of cholesterol and ending up with the problem. So this sort of extreme, non-scientific and unhealthy way of practicing diet can lead to the problems.
But is it necessary? Because what I have also been told is that
No,
your
it
body
is
has
not
enough
necessary.
protein.
It is not necessary. I'm a pure vegetarian. I'm 74 years and absolutely fine, and I can do anything. I can run even marathon. So it is not necessary. I told you Virat Kohli's example, no? So there are lots of people, and I told you elephant is also vegetarian.
Elephant.
So the sprouts, the what to say, the you get the best protein with the sprouts and the dicotyledon thing and the pulses.
Absolutely. Thank you so much. So I think, do we have any other questions on the floor? So I think we would like to have a take-home message for everyone on this forum. What in terms of lifestyle, in terms of your field, please let us know what is your take-home message for everyone.
Monica wants to give to a take-home message, or you want me to give the take-home message?
You both can give. I am okay with that.
Yeah, I know. Okay, Monica, I'll finish it. So my take-home message is just be happy and smiling. Don't take anything to your head and don't become aggressive and in a fighting mode. That is the first thing. The second thing is, eat less, work more. The third thing is do regular exercises, keep your body weight in control. And the third one is sleep well, and then don't oversleep and don't have the sleeplessness also. And the fifth one is just leave everything to God and do your work best. And that's the way to be healthy, happy, and prosperous. Thank you. Over to you, Monica.
You said it amazingly well. And I think what I just want to say is for women, we take care of a lot, and we have to be very aware of the physiological changes that we go through. And we need to respect that we need to follow a very practical way of living to make sure we stay healthy.
Very well said, Monica. In fact, mother or a woman is like, pillar of the family. And she should know what food to be given, served to the family. We call them as Annapurneshwari. And then the healthy habits are taught by the mothers. And they should be healthy before they teach the their children. And that's how, the women should take care of their health and not to go for the Western style of smoking, drinking, and partying and drugs. They all will destroy the life.
Just recently started, a kind of a lifestyle modulation and change in my body where I have started, obviously, a lot of people say, and we don't follow that because of the lifestyle, but I started having dinners before 7.
Great.
And the reason is that, today I have understood the reason. The body, the more late you eat, the body is still digesting while you are sleeping. Your body organs are still functional. The body has to digest, and then it has to clean the body. So if you don't give time enough, for a gap between your dinner and your breakfast, it affects your heart, it affects your, every kind of a body organ which is there, because your body did not get time to clean it. So in the morning, what I've done is, instead of having a breakfast right when I wake up, I start having a water or some kind of a, some kind of a juice or something which is like a non, uh, uh, like a, a like a water, like a coconut water or something, and it gives time to clean the body, and then I have a breakfast after 2 hours or something. So it really helped.
Saurabh, whatever you are telling is not a new thing. This is what we practiced in the past. From the childhood, as soon as we got up, we used to have a glass of water with the lemon and honey. And that is the best in the morning. And why you have to eat early is you have to give a long gap for the digestive system as well as the body cells to recover and regenerate and recoup themselves. And the water, according to Atharva Veda, is called as the Jiva Jala, or it is the best balm that can heal the body cells. So our blood to circulate well, the water content is very important. So drinking water adequately is also as important as what you eat. So fasting, the Nobel Prize was won by the Japanese person, but that is known to us for thousands of years as Upavasa. So Upavasa is nothing but the best way of living. So as a result, taking the fruit juice and not the canned juice or the aerated drinks or the sugary syrups, they are all very bad to the children as well as the youngsters.
Absolutely. And also you should just consume food which is perishable after a few hours or a day, and not stored for months and months, which is having a,
okay, maybe next time I can talk about Ahara, Arogya, Adhyatma.
Perfect.
So
I
how
think
to
with
live
this
healthy.
note, so with this note, we are inviting you for another session on Ahar and lifestyle
Arogya
modifications and food habits. So I think we will contact you for that. That session should happen very soon. With this note, we would like to close the session, and thank you so much for the wonderful and insightful knowledge which you have given and shared with us. And we will let you know if you have any further questions coming on the forum. So thank you so much, ma'am. And it was
thank you so
very,
much.
very nice.
Thank you, Saurabh. Thank you, Monica. And thank you, everyone. Thank you. Have a great day. Good night.
Thank you again. Thank you.
Thank you. Thank you.